Hi, I'm Suzanne Guerin, PSI member and currently head of school at the UCD School of Psychology. I'm hoping today that I can share some information that may be helpful to postgraduate research students in psychology in relation to some of the challenges that they're undoubtedly facing in the context of the COVID-19 restrictions. There's no doubt that this is a very stressful time for many people dealing with restrictions and fear around the virus itself. But in all these things, there are challenges to do with our work and our family and our friends. And for those of you who are postgraduate research students, you may be facing some particular challenges around ensuring that your research progresses at this time. So hopefully I can share some ideas and suggestions that might help you to manage your work during this time. The first thing I would say is that it's really important to stay in touch with your supervisor, whether that be through Zoom, Skype, or even by phone. Being able to link in with your supervisor will support your decision making and your problem solving, even identifying the issues that are ahead in the current context. And in reality, they're best placed to be able to help you work through some of the challenges that you may be facing. It's also important that you stay in touch with your classmates. Remember, they're on the same journey as you, and whether you are tutors and demonstrators together, or whether you share a study room, or whether you're working collaboratively on a shared project, it's really important to identify them as a source of support, but also a source of advice and information in that problem solving that you may be having to do. In terms of the possible implications for your own research, I'm sure you're facing a range of challenges at the moment, including reduced access to the participants for your study, maybe being unable to get into the lab to collect your data, but also possibly delays in administrative tasks such as ethics applications being reviewed or feedback coming through from journals. I think we're all very conscious that members of the research community will be facing multiple challenges that could impact on their time, and that can have implications for your research. But there are a number of things that you can be thinking of and maybe planning and doing while your mainstream research plans might be affected by COVID-19. The first thing I would say to you is to think about your literature review for your thesis. And depending on your approach to your thesis, this may be something that's done and dusted. It may also be something that still has to be done. And as a contained task, it is something that you can focus on if you can't collect data. You might also consider conducting a systematic review, which is a very publishable piece of research, a very publishable methodology, and could be a very relevant addition to your thesis. And systematic reviews, though they do rely on good internet access and access to library resources, are much more feasible at a time of restriction because it is predominantly desk-based. So you could look into designing or completing a systematic review that would be relevant to your thesis. The next thing to do is to think about data collection. And again, many of you may have your data collection curtailed because you were collecting data in schools or applied settings, or possibly bringing people into the lab. So think about whether there's a way to adapt your work to take account of the availability of your participants. If you're working in the health field and you're looking at the impact of a particular intervention or outcomes for patients or service users, are there ways in which you can conduct a study with the professionals, the staff who work with them, exploring their perspectives on the issues? So for example, what are psychologists' views on the most effective treatment for particular difficulties or challenges? Or maybe what are their perspectives on diagnosis and intervention within these areas? You may be able to identify gaps in the existing literature that explore professionals and practitioners' views. That would be a very valuable contribution to your thesis. So you can think about the options around that. Of course, if you've had the opportunity to collect your data, there are tasks such as data analysis and write-up that can be done while you're facing these restrictions. But obviously, we should recognize that any of those tasks are demanding and need your attention. And at a time when you may be experiencing anxiety or worry around the current context, it may be difficult to focus on those. But I find that those tasks are very forgiving, and they do allow you to step away from them and come back to them refreshed, hopefully a little bit relieved and able to concentrate more. So do take regular breaks. But I would caution you around separating yourself from your research for too long. It is important that you maintain a good contact with your studies, with your project, with your research, so that you're not having to remember where you were and what you were doing in the past. If you can, if your circumstances allow, make time for your thesis, your research every day, or every other day if you're facing particular challenges, so that you can connect with the topic and stay in touch with the work that you're doing for when worries are reduced and access may be returned. In research, it's really important that you are very aware and critically aware of the work that you have been doing. As researchers, we regularly critique our own work to identify the strengths and limitations. And I take that idea and carry it into your current work in the current context of COVID-19 restrictions. Think about how you document the way in which you've dealt with any challenges that have come up. If you faced challenges in your research, what was the decision making and problem solving that you underwent? Keeping track of this can be really important, and really important and interesting part of your thesis. Being able to reflect critically on the decisions that you made and the factors that influence them is something that an examiner will be interested in hearing. And it may be that a reflective journal or a reflective component of your thesis will allow you to capture that. I suppose my final thought, though, recognizes that this is a very unusual and strange time for many people. It's a challenge personally and professionally for many people. And it is hard to be thinking about work and studies at this time. But it is really important to recognize that your research is very much a part of who you are and part of what you do. And it is important that you can continue with that work in a way that will help you to progress and move closer towards the completion of your master's or your PhD, whichever route that you're on. But the key thing is that it's not a time to be disconnected. It is a time to be in touch with your supervisor, your peers, and other supporters around you. And while maybe some of those people won't understand the research challenges that you face, they will be well positioned to offer a human ear, to offer advice, and to support you in the decisions that you have to make. So I'll just finish by saying best of luck to you all with your research at this time, and I hope things will settle down for you all relatively soon. Take care.